Hey, did you freaking remove your gallbladder or are you thinking of it? Stop and listen. This is very important. Did you know that your gallbladder is a tiny organ with a huge impact on your health? Most people don't realize how important it is until they have problem with it. And if you're dealing with gallstones or considering gallbladder removal surgery, pay close attention. This information could change your freaking life. By the way, please don't forget to subscribe and like this video, and do watch until the end, as I will always share secret, hidden, unconventional options. First of all, what is the gallbladder? See, let's start with the basics. See, your gallbladder is a small, pear-shaped organ located under your liver on the right side of your abdomen. Its main job is to store and release bile, a yellow-green liquid made by your liver. So bile is like a digestive enzyme. When you eat, your gallbladder contracts and squirts bile into your small intestine, and bile acts like a liquid dish soap, breaking down the fats from your food into tiny droplets. And this makes it easier for your pancreas enzymes to actually further digest the fats, so your body can absorb all the healthy nutrients like vitamin A, D, E, K, and essential fatty acids. So without bile, you literally cannot properly digest and absorb fats and fat-soluble vitamins from your freaking diet. Talk about an essential function, right? Gallbladder problems, sometimes things can go wrong with your gallbladder, and the most common issue is gallstone, hard pebble-like deposits that can actually form when there is too much cholesterol or bilirubin in the bile. So gallstones can be actually agonizing, causing severe pain in the upper right abdomen, nausea, vomiting, and even fever if they block the bile duct. And many doctors recommend surgically removing the gallbladder. However, this is a big deal because up to 40% of people who actually have their gallbladder removed end up with persistent complications and symptoms for a year or more. And these can actually include diarrhea, constipation, bloating, gas, and a feeling of fullness or pain under the right rib cage. So what causes gallstones? See, the main culprits behind gallstones formation are bile deficiency and excess cholesterol in bile. So when bile flowing from your liver to the gallbladder becomes too concentrated with cholesterol, it can precipitate out into heart stones. And there are several factors that can actually increase the risk of this happening, including estrogen dominance from birth control, pregnancy or hormone imbalance, diabetes and insulin resistance, rapid weight loss, strict low-fat, low-calorie diets, cholesterol-lowering medications, liver disease impairing bile production, inflammatory bowel disease like Crohn's, or even family history of gallstones. So as you can see, very different conditions and scenarios can actually lead to bile deficiency and gallstone risk. And this underscores how important healthy bile flow is for overall health. So don't give up on your gallbladder too soon before agreeing to gallbladder surgery. You may want to explore some other options first. And one alternative is lithotripsy, which uses actually sound waves to break up gallstones so they can pass more easily. Dietary and supplement approaches may do also help. You see, gallstones often form when bile gets too concentrated and sludgy due to a bile deficiency. Things like estrogen, stress, diabetes, obesity, liver disease, and even strict low-fat diets can actually reduce bile production and flow. And simple bile support, increasing bile flow, is often the key to preventing gallstones, dissolving sludge, and actually improving overall digestion. With or without a gallbladder, here are some easy tips to follow. So take bile salts supplements with meals. These provide a temporary boost to bile to support fat digestion. Start low and adjust as needed based on your digestion. Use bitters before eating. And bitters formulas contain herbs like artichoke leaf, dandelion root, and milk thistle to help stimulate bile production. Get quality sleep. Your body makes antioxidant melatonin during sleep to actually protect bile ducts. And poor sleep sets the stage for bile issues. Avoid estrogen dominance. High estrogen from birth control, obesity, or hormone imbalance reduces bile flow. Stay hydrated. See, bile can actually get thickened when you're dehydrated, So drink plenty of fluids daily. Eat moderate, healthy fats. See, fat in your diet actually signals your gallbladder to release bile. Just don't overdo it. Manage blood sugar. See, high insulin levels from diabetes, overweight, or high carb increase gallstone risk. And if you follow these tips and your gallstones are still problematic, lithotripsy may be an option to pulverize them before considering surgery. And if you end up having your gallbladder removed, don't stress. Millions of people live healthy without one. Your liver still makes bile to actually digest fats. However, bile flow may be less regulated without the gallbladder reservoir. And to optimize digestion, focus on getting enough bile support from bitter herbs and potentially bile salts if recommended. Now, you may also benefit from eating smaller, more frequent meals, lower in fats until you adjust, using digestive enzymes with meals, especially lipase for fat digestion, gentle self-massage, acupressure on the left side over your pancreas between meals. This can actually help stimulate pancreatic enzyme output. Watching your stools. Pale, greasy, floating stools often mean you need more bowel support. So the key is being patient as your body, of course, adjusts. Most people regulate bile flow within, let's say, 6 to 12 months after gallbladder removal. And during that time, be vigilant about diet and supporting your digestion. And one last gallbladder fun fact, did you know that your bile actually helps control cholesterol levels? That's because bile is made from cholesterol, and bile is essentially uses up cholesterol by carrying it out of your body in stool. So when you don't make enough bile, your liver actually compensates by producing more cholesterol to make bile, potentially leading to high cholesterol issues. And managing bile flow could be a missing link for some people with cholesterol concerns. So this is yet another reason to be proactive about your gallbladder and bile health. See, eating plenty of fiber, exercising regularly, and avoiding a diet too high in sugar and unhealthy fats can also support cholesterol balance. So the take-home message, don't underestimate the power of this tiny organ. Your gallbladder and its bile production play a huge role in digesting fats, controlling cholesterol, and even influencing your overall health. So pay super attention to signs of bile deficiency, explore alternatives before surgery if possible, and learn simple tips to optimize bile flow with or without your gallbladder. Now, as a clinical researcher willing to think outside the box, I will share some more unconventional supplements and remedies for gallbladder support. Now, this is for pre-gallbladder removal. Gravel root. Now, this herb has traditionally been used by Native Americans as a stone breaker for kidney stones and gallstones. Now, typically, the dose is about 1 to 2 grams daily of the dried root. DMSO solution. Some people use dimethyl sulfoxide as a solvent to actually try and dissolve gallstones. And one unconventional protocol is mixing 1/4 teaspoon of DMSO with 1/4 teaspoon of olive oil and drinking it daily. Horse chestnut extract. The sapoins in horse chestnut may actually help break down cholesterol gallstones, and typically the dose is between 300 to 600 standardized extract daily. So now for post gallbladder removal, you have ox bile powder. Rather than the encapsulated ox bile, some people opt for the raw desiccated ox bile powder and take 1/4 to about half a teaspoon with meals as bile replacement. Pig pancreas powder. Desiccated pig pancreas powder can actually provide pancreatic enzymes in a potent, economical way. Typical dose is 1 to 2 capsules with meals. Crude lecithin from soybeans or sunflowers may be used at a dose of 1 to 2 tablespoons daily to actually provide bile emulsifiers. Now, other unconventional options, you have apple cider vinegar. Some people drink 1 to 2 tablespoons of apple cider vinegar daily, as the malic acid will help soften gallstones. Castor oil packs. Now, applying castor oil packs over the gallbladder area is thought to help promote bile flow and stone exclusion. And of course, you have coffee enemas. Thought is controversial. Some do claim coffee enemas help purge bile and dilate bile ducts for stone release. Now, of course, many of these options, they lack solid research on their safety and appropriate dosing. They would be used at your own risk, of course. I would have the person definitely start low and monitor effects slowly. And I would likely combine some of these unconventional remedies as complementary options along with the more mainstream supplemental protocol I mentioned previously. So let me know if you need any other creative recommendations from the fringes of gallbladder treatment.